It is a huge honor today to be interviewing one of the original townies from 2003. We both graduated the same year in 1987. Dude, you have 7,500 posts. I feel like you're a brother, a cousin, a nephew. Thank you so much for giving me an hour today.
It's my pleasure.
And your name, Dino Napoletano, but you on the board you go by Dino. I'm a huge fan of your 7,500 post. I mean, in all those years, the last 12 years, you've covered everything from A to Z. And what I love most about these podcasts, believe it or not, is not that I guess is a certain know-it-all expert in one little area. But the feedback I'm getting. I've had a monthly column since '94, and I get fan mail from that. I've had the 30-day MBA. I've had different tape series, books, lectures. But I've never got anything close to the fan mail I get off these podcasts. And it's always the same thing. It's always someone telling me, they're either juniors or seniors in dental school to 10 years out from every country on earth. And they're just, I got one this morning, and a dentist said, last night I drove home an hour commute from work. I listened to your podcast. And I was thinking, and it's all free. What is the chance I could have had dinner tonight with you and your guest, and to hear that conversation for an hour was just so amazing. And it was free, and it was fun, and it's metaphysically impossible because, this dinner between you and I right now, like we're having dinner or a beer at a bar. I mean, this is just a really cool technology to be able to podcast.
To be honest with you, Howard, I never really listened to many of the podcasts before you asked for me to be on one, and I've never done one of these, But after you asked me to be on one, I started listening to quite a few of them, and I just thought it was so cool that it's just like having a conversation, and you can do other things while you're listening to it, and it's amazing. I always come away with something after listening to every single one of them. It's just unbelievable to me.
Well, it's an amazing progress because at the end of the day, dentists want to learn more about dentistry. And at first it was just you had to go to a course. And the problem with going to a course is that the average dentist is going to do $4,000 a day. So to go to the course, it's going to cost you $4,000. You're going to have to close your office.
Exactly.
Then a lot of times you're going to have to travel and take your staff and pay your staff and all that stuff. And then it went to desktop. We put up 307 online courses on Dentaltown. And granted, they got AGD, ADA approval, whatever. But you got to sit at a desk staring at a computer. And the reason, and those have 500,000 views now. Those 307 courses have been viewed 500,000 times. But here's what's interesting. These podcasts, I've only been doing podcasts for 7 months. We've been doing online CE from 98 to 2015. That's 17 years for 500,000 views. We've only been doing podcasts for 7 months, and we're at 100,000.
Wow.
So and it's exactly like you say, because they can listen while they're commuting home from work. Which is half rural. The rural dentists have an hour drive, just like the dentist in LA has an hour drive. So it's the commuting, and it's the multitasking. It's you're on the treadmill, you're doing laundry, you're doing the dishes, you're cleaning the house. And I have several friends that say that Saturday morning their routine of cleaning up the house for the week and getting in all the laundry and everything is about 4 hours. Then they listen to 4 one-hour podcasts back to back in their headphones while they're doing all the dishes, the laundry, the vacuuming, sweeping out the garage. Everything's done. So I'm going to start first so you graduated in 87. So are you 52 years old too?
No, I'm 55.
You're 55?
I lost a year. Well, I have an interesting history. Because
it's always a good story when a dentist starts out with the word, this is an interesting story. That means it's really going to be interesting.
So I barely graduated from high school, but funny, I knew I wanted to be a dentist since I was a teenager.
How's
and
that? Was your dad a dentist? An uncle, a cousin?
No. My dad was a painter, but we were going to a dentist for a long time, and these new guys came in town, and so they had like a super modern practice at the time in the early 70s. And I went in as a patient, and it was a completely different experience than what I experienced with the other dentists. And it just made such an impression in my mind, that I was like, wow, this is a really cool thing to do. Dentistry isn't as bad as you hear people say. And so the dentist that I went to, who actually became my role model, When I went and asked, how many years is it to become a dentist, and they said 8. I was like, oh man, there's no way I'm doing that. I hate school. I hate school. So, at any rate, I got out of. I barely made it out. I got accepted to 2 schools, one in Florida, St. Leo College, and one in Marist. And coming from an Italian family, very strict, my parents wouldn't let me go too far. So they said, no, you have to go to Poughkeepsie, which is 45 minutes from Middletown, where I am now. And so went to Poughkeepsie, partied my butt off, and, I never had a chance to grow because I was home every weekend. My mom she would cook me like, lasagna and stuff, put it in Tupperware. And so all I had to do during the week was just shove it in the toaster oven, warm it up, and I was good to go. She'd do my laundry. So I think I never really had a chance to grow. And basically, that whole year, I just wasted it. I mean, I partied like heck. It was a great time, but got a letter in the mail telling me that you can't come back. You're done. And so at that point, that's when reality set in. And, my dad says, okay, you're going to paint with me now. So after about a couple of weeks, he looks at me and he says, you want to give it another shot? I said, yep. I said, I do, but I got to get out of here. I can't stay near home. I got to go to Florida. Now, I called the school in Florida, right? I hadn't applied for that year, but I was accepted the previous year. But I just called them. It was a very, very tiny school at the time. And I said, I wasn't accepted there this year. I was accepted last year. Any chance I could come this year? And so she put me on hold for like 20 minutes. She came back on the phone with a real heavy Southern accent. And she goes, Donato, she goes, come on down. So, and that's where my life, that's where everything started. So needless to say.
And how old were you at that time? Were you
so at that time,
19 or 20?
I was 19.
19?
Right. 19 because I finished, 19 to 20, right. So I get down there, and the first most important thing that happened to me was that I finally end up meeting with the right people. And so I ended up meeting one person in particular who, because coming from an Italian family, my dad only had a second grade education. My mom only went up to 6. They were immigrants. So I wasn't really, I didn't have the support at home that, let's say, my kids had through school. So I didn't have help, I couldn't get any help. And so school was always a very negative thing. But when I went to St. Leo in Florida, needless to say, I didn't even tell them I went to Marist that one year because I wanted to start clean, fresh. But I met one person, and he basically just sat with me, and he said, you can do this. He says, he goes, I'm going to teach you how to study. And so just a few sessions, and the next thing I know, I get the first A in my life. And after that, it was like a drug. It was like, holy crap. Once I knew I could nail it, I was like, oh man, all right, no problem. I can do what I want to do, what my dream of being. And so, the only reason why I share this in such detail is because I want people to understand the perspective that I come from when I'm on a thread on Dentaltown and someone says something can't be done. I went through all of my life up until 18 years old thinking that I couldn't do something, and then finally realized that I could. All right. So when I see these threads, it always reminds me of that. And so, I'm always looking for things that can't be done to see if there's possibly a way of doing that in a little different way. And man, Dentaltown has been like a complete, if I didn't discover Dentaltown, I wouldn't know anything what I know today.
And it's also a great parenting lesson for kids listening, dentists listening that have children, in the fact that so many people do poorly in school because they don't have a dream or a vision. They're just, it's hard to tell someone to work hard and study all day when they don't even know why. It's like, why am I busting my ass learning English and history and philosophy and chemistry? And they'd rather just go sit at a bar and have a beer and try to find the meaning of life with a friend. And then when that kid finds a mission or a purpose, then boom, the tires hit the pavement and they take off.
That's exactly what happened to me. It's like once I realized I could do it, there was nothing standing in my way anymore. It's like that's it. I'm
I mean,
going.
we all know people who made C's, D's, F's, and flunked out of school and changed majors 6 times. And when they finally decided what they wanted to be, then they were the all-star student, and everything took off.
I'm saying it's funny because I look at my kids today, and
How many do you
you
have?
know, I have three boys. One just graduated college. Actually, he graduated from the same college that I graduated from in St. Leo.
You have
And
three boys?
three boys.
What are their
So,
ages?
so one is 22. His name is Umberto. He was named after my dad, and he graduated St. Leo just a few weeks ago. Second boy is Sergio. He's 17, actually 18, and he's finished his freshman year at St. Leo. And then I have another little guy named Donato, and he's a freshman in high school. And I don't know what he.
So you
what
started, did you marry late or just started having kids late? Because we're the same age. My boys are 20, 22, 24, and 26.
Yeah, I started. I started late. There's actually 13 years between my wife and I, because I was 32 years old and I wanted to have a family, and I was so lucky to find her. I mean, what luck that was, and just a great person, and she even actually works we work together in the office for the past few years. She went back to school when we got married. She was only. Well, when I met her, she was 17. She was 18 when we were married. So she didn't finish high school in Rome. She was born and raised in Rome. We happened to meet in Middletown just by chance. And so when the kids were like halfway through school, she decided she wanted to go back to school. So she went to college, and she got her high school diploma through there, and she actually ended up going into hygiene, and she's a hygienist. So
She's an RDH?
she's an RDH.
Awesome. That is
Yeah.
awesome.
And she does like everything. It's great because she can cover the front. If I have somebody out in the front, she actually she's my chairside assistant 2 days a week, and then she'll pick up hygiene. She has a few patients that prefer her and request her, and also if my regular hygienist who's been with me forever, if we can't squeeze in a patient, she'll take care of them. But
I am still bummed I do not have an RDH degree because, I knew I wanted to be a dentist since 6th grade. I don't know why I didn't go the RDH route because in dental school, about 12 RDHs were in the class, so they already knew half the curriculum at least. And then their part-time job back in the 80s, they were making like $20 an hour doing hygiene back in 80, 84 to 87. And I was at Walgreens making $3.50. And so they were making $20 an hour while in a dental office and learning all about dentistry and all this stuff. And in med school, same thing. The street smart physicians, they became phlebotomists or registered nurses first. So they were making bank all the way through med school, and all their undergraduate applied to their med school, dent school. So if somebody wants to be a lawyer, they should be a paralegal first. You want to be a dentist, go become a hygienist first. You
I
you want to
agree.
go to med school, go become a registered nurse. If that's too much of the time, become a certified nurse assistant, something. But that's smart. I also think these RDHs were the best in dental school because when the instructor was saying something, they worked in it. They knew it. They saw it. They could see patients' faces in their heads with the cases they were showing on the PowerPoint. So
Exactly.
that's just amazing. So so what struggles and hurdles have you encountered on your journey to becoming a dentist and while starting out in private practice?
Well, I spoke about the major ones when I was in school. Then, of course, coming out of school, I started two scratch practices a year apart from each other.
In
And
87.
so,
So you graduated in 87 and you started one in 87
well,
and one in 88.
all right. So I missed one part in there. I did a GPR residency at a university in Alabama at the VA hospital, and I didn't finish it off there because they didn't deliver what they had promised at the time. And so an opportunity came where there was an office, actually where the first dentist that I went to as a child, he had passed away 5 years prior, and the wife wanted to just rent the space. It was in the house of a basement. Had one room had like the old barber style chair. The other one had a real old Ritter, at least lie down chair. So I got rid of the barber chair, just shoved one brand new chair in that room, and I was in business. But I thought that, coming back to my hometown, that I wouldn't have a hard time starting a practice. But unfortunately, things were not going well at all. And so I had
in the town.
in my hometown, right?
Where was that?
In Middletown,
Middletown.
where I am now. Yep.
So
And
were you born in Middletown?
I was born and raised in Middletown.
Middletown, isn't that is that also where Zuckerberg practices?
No. He's no, not in Middletown. I think he's closer to the city.
Am I thinking Middletown? Is there a Middletown, Connecticut too? Is that where Kenka practices?
Yes. It's amazing that you've mentioned Dr. Zuckerberg because I never heard of him until I just heard his podcast the other day. That was a good one.
Yeah. His son started Facebook. So Kenka is in Middletown, Connecticut, and you're in Middletown, New York?
Dr. Kanka is near Middletown, Connecticut, correct?
Okay.
And I'm in Middletown, New York, right?
Okay.
Yep.
So that Middletown's like a Springfield. They say Springfield's the most common name in America. Like 43 states have a Springfield.
Oh yeah, a lot of states have Middletowns.
That's why on The Simpsons they went with the name Springfield for The Simpsons because it was the most common city. It was the most common name. So you went back to where you were born and raised, and
Right.
and Middletown was having economic hardship. What is it? A suburb of Manhattan? Suburb of New
Well,
York?
it's about an hour and a half north of the city.
Okay. So
And
small town, upstate
So
New
it's a
York.
smaller town, but really saturated, with dentists. I mean, at that time over 50. Today there's probably over 100.
And what's the population of the town?
The Middletown itself, 25,000.
Okay.
And the surrounding town, another 25,000. So really looking at a population of about 50,000.
With
So
100 dentists?
with 100 dentists actually today, right? With over 100. So things were going well the first year. So I said, you know what? I said I'll
Damn, that's a dentist for every 500 people.
yeah.
Did I do the math right on that?
Yeah. That's rough.
That's real rough. I mean, the United States averages a dentist for every 1,890,
Uh-huh.
and you're in a town
Right.
of 1 to 500.
Right. Well, at that time it was 50 dentists with 50,000. So at that time it was 1 to 1,000. Today it's more like the 1 to 500, like you said.
Yeah, but even back then, I mean, it's almost 1 to 2,000 for America. So even back then, it was 1 to 1,000. So it's already had twice as many dentists as the national average.
Exactly.
So it's always been tough.
Yep. It was
So
very hard.
so you opened in Middletown.
Yep. And after not even a year, I said, I think I'm going to start a place in a smaller town where not so many dentists. So there's a town near me in Montgomery, New York, about 15 miles away. And so I opened a satellite practice there, another scratch start. So interestingly, at that time when I went to the bank to get the loan to start that office, they didn't require to see any paperwork for the chairs or anything. So they gave me like 80 grand, and 40 was supposed to be for the build out and 40 for the equipment. And so since they didn't ask anything about the chairs, I said, you know what? I said, I'm going to keep that 40 as working capital, and then I'll just lease the chairs for that second satellite. And it's a good thing I did, because I ended up going through that entire 40 grand. And I remember thinking, that's it, I'm done, right? And the very next month, I freaking broke even. It's like, okay, and then made a profit ever since.
So let me throw in an MBA tip because I got my MBA from Arizona State University. But believe it or not, the number one cause of a business going bankrupt is cash flow. The business was profitable, and the point is, like say they make a sale. Well, they had to pay their bills for that sale, the rent, mortgage, equipment, bill out, computer, insurance, payroll every the first 15th. But maybe the terms are net 90. And they're selling, they're making a profit, but since the money's not coming in for 90 days later, they don't have the cash reserves to pay. So the number one reason for any business, there's about 50 There's 40 to 60,000 bankruptcies a year in the United States, depending on if we're in a boom, and it's closer to 40. When we're in a bust, it's closer to 60. And the number one reason that businesses go bankrupt is they run out of working capital. So this is a great lesson for these kids listening to this thing. I'm going to start my own practice. That working capital, people borrow money for a chair or carpet or paneling or a build out or a toilet, but they don't borrow money for working capital. And you got to have working capital. And there's a little luck in every success story, and you lucked out that you turned cash flow positive before your cash flow reserves of 40 grand ran out.
I was very fortunate. And so things started really cooking along. From that point on, everything started clicking along very well.
And also, a lot of physicians, dentists, and lawyers they all have to be book smart. You can't be a doctor in anything without being book smart, obviously. But a lot of them are street smarts, and it's interesting how you had the street smarts to realize that supply and demand, this small town needed a dentist. There was less dentist population ratio, and you were in a town that was saturated, and dentists still deny demographics. They still go to the busiest intersection in America where there's 20 dentists in a medical dental building and say, I'm going to sit up here. And you're just sitting here like, how do you think that? I mean, you've never seen 20 McDonald's in a McDonald's building. Why would you? I mean, there's that one building in New York, in San Francisco, that has 166 dentists in one building and 7 labs. And you're like, what? So that's neat. So you're street smart, and you went to the rural area where they needed you.
Well, it's not really rural. To be honest with you, I never wanted to come back to Middletown because I knew the demographics weren't in my favor. But, tight-knit Italian family, my parents, especially my dad, he was like, no, he goes, you got to come back to your town. You got to come back to your town. I was like, no, Dad, I want to stay in Florida. It's like, no, you got to come back. Like, all right, fine, I'll give it a try. And, but, I have no complaints. I'm so happy. Middletown's been great to me. It's great to meet people that I know since I was a kid that are now patients of mine. And so, it's been a really rewarding experience from that aspect of it. Definitely.
Every time I get patients and they're from out of the city, I'm always wondering, like, why are you here? Or they're coming from the other side of town. I'm saying, so why did you drive an hour or 2 hours or 3 hours? And they go, well, you were my mom's dentist for 25 years. And I went, it's like, wow. It's like so many of my new patients are kids from far away. And their mom came to me. So I want to back you up a little bit because one of the most asked questions we get from the dental schools, probably the number one question is, should I do a GPR, or should I open up my own practice, or should I get an associate? You give them, so that dental student, he's a junior, senior right now, and she's listening to this. She's thinking, should I do a GPR? And you've been out 28 years, and you got 7,500 posts in dental town. You know all the thoughts and opinions on GPRs. Talk to that little kid about whether they should do a GPR.
That's a great question. It obviously depends on the GPR program. The one that I went to at that time, promised the world, and I ended up being stuck in the clinic just doing fillings and dentures. So I didn't feel like I was really gaining anything more, from a learning perspective, and which is the reason why I didn't end up finishing there. But I've taught courses on microscope integration at like the Tufts GPR program, and completely different story there. They have all the technology. The instructors are great. They expose the students to a lot of things that they probably would not be exposed to if they would have maybe just went for a job right away. So it really depends on the program. Each program is going to be a little different. My reason for wanting to do the GPR was because I wanted to do cases in the OR. So that was really my main purpose for doing a GPR. And that's the reason why I left, because 9 months into it, I haven't even stepped foot in the OR. And it's like, well, you're not. What
interested you about the OR? Did you actually want to do sedation dentistry, or what about the OR? Or did you want to learn?
I've been on staff at our local hospital here, Orange Regional Medical Center, since 1989. And
Wow.
I always had an interest, and I'm still trying to get them interested in starting a program here, because right now, when I have a patient that requires special needs, they need to schlep down to the city. And, it's already stressful enough as it is. And when these patients have to drive an hour and a half, just to get some teeth filled under, general, that's a major pain. And so Middletown is slowly getting there. They just opened their first medical school called Toro Medical College last year. And so they're going to have like residency programs here at our hospital. And so I'm actually hoping that in time that they would maybe consider like a GPR program, hospital-based, right here in Middletown, and which I would be more than happy to.
So you're doing hospital dentistry cases?
Well, in the beginning, I would just go in, if it was emergencies or whatever. But right now, the hospital's not set up to do hospital dentistry cases, and I've been working on it, and I'm still trying to work and see if we can get something like that started.
So why do you have privileges with a hospital since '89 if you can't do dentistry in there?
Yeah, it's kind of ridiculous, isn't it?
But now,
they don't even have.
Do you do sedation dentistry in your office?
They don't even have a dental department per se, so they kind of just throw. There's only a few of us dentists on staff there, and they just throw us onto the ENT department. And so my goal is to eventually get a actual dental department. I'm sorry, can you ask that again?
Do you do sedation dentistry in your office?
I used to do oral sedation for a couple of years, and I stopped doing it because I wasn't comfortable with that mode of sedation, and because I had a few instances where, where the patient after the second halcyon pill or third one, where they were really, I'd have to keep shaking them to get their PO2 levels up again, and so it's like I was like, I don't really like doing this.
I just want to say one thing to our listeners out there, and the other thing about this is the 20% of these listeners on every podcast are from every country on earth. So, I mean, they're listening to this in Tanzania and Eritrea and everything is that. But I'll tell you what, when anything, I see the claims made each month from some of these dental malpractice that, that give me the data every month of all the claims paid. And whenever it's a full max, whenever it's a complete disaster, whenever it's the whole $1 million or $3 million or whatever, it's always an IV and it's always a death. And I didn't do it because let's say you provided the service and it was good and you did a case a month for, 30 years. One death would negate all that times 3, not to mention you'd have depression and want to quit and it'd be hard to go back to your office after someone died in there. It's so bad. And the standard of care in every hospital is that an anesthesiologist does the anesthesia and the surgeon does the surgery. Nowhere in any American hospital ever is a cardiologist doing the IV and the sedation while doing a bypass on your heart. You won't find it in any hospital. You only find it in America in oral surgeons' offices, dental offices, and man, when something goes wrong, that's the first thing they point out to the juries. Like, where else could a surgeon done the IV and removed and done the surgery? And it's just, so I would say if you're going to do anesthesia in your office, I mean, now granted, I'm in Phoenix, which is, there's a lot of anesthesiologists, but there's 10 different anesthesiologists I can call that will show up in my office and they open up their van or their truck and they got a dolly and they will everything right into the operatory. It's all their equipment, all their drugs, all their expertise. They do the IV sedation or whatever, and I just do the dentistry and I have the patient pay the anesthesiologist direct with their medical insurance, whatever. I don't get involved in the money. I don't do anything. It's a pure independent contractor. You know what I mean?
That's actually a fantastic idea. I think I'm going to consider actually doing that.
And you know what's amazing is there's a half dozen dental schools that do the anesthesiology residences. So instead of because you can get an MD anesthesiologist, you can get a registered nurse anesthesiologist, but you can get a DDS. I think Oregon has one. Several schools have one, but they're dentists. I mean, they could literally do the root canal. They could do all the dentistry that you're doing, and it's really cool because the anesthesiologist is a dentist, so they know what's going. They know what a pulpotomy is. They know everything you're doing. It's not like explaining to a nurse anesthetist or an MD anesthetist You don't get these questions like, well, what is this going to entail? I mean, when you tell a dentist, anesthesiologist, well, we're doing a root canal number 3, they're like, oh yeah, they get it.
Even the surgeons that I refer to right across the street from my office here, they when they do extractions under anesthesia, they have a anesthetist come in. They don't do it themselves anymore. And
Yeah, yeah. They probably talk to a lawyer.
yeah,
I mean, you got to remember in this country of ours, there's 940,000 MDs and there's 1 million attorneys.
uh-huh.
And your government, the Congress, the Senate, and the president, they're all attorneys.
That's right.
And they don't make rules for dentists and physicians. They make
Exactly.
rules for other attorneys. And
Exactly.
that's yeah. So attorneys, there's 1 million attorneys, and they bill out $1 trillion a year. So basically, in America's $17 trillion economy, we pay one out of every $17 spent goes to the lawyer country club. You know what I mean?
Right.
And
Exactly.
it's a hell of a game, and you need to be aware of that game because it's bigger than dentistry and it's bigger than medicine, and it's probably bigger than anything because it's the government too. So you're when I read your post, 9 times out of 10, you're talking about technologies. You were talking about doing a microscope in this residency deal. Why are you in there teaching what are your favorite technologies? I mean, what technology do you like? I mean, some dentists are into tech more than others. What technologies do you like and think they have a good application for dentistry?
The technologies that I love and use regularly are number 1, microscopes, number 2, Lanap, number 3, CEREC.
Okay, well, let's take those one at a time. And I want to, first of all, I want to say this. Whenever two 50-year-olds are talking about microscopes and loops, the 25-year-olds, they just see two grandpas, these old guys, and they're like, yeah, well, you need that, Dino, because you're old and you can't see and you're blind. But I'm 25. I can run 5 miles and my eyes work. Talk to that kid. Does a 25-year-old with 20/20 vision need to wear loops in the office? And would they do better dentistry with a microscope?
I don't know about, microscopes, but definitely, I mean, you have to start out somewhere. I don't think anybody can start fresh out with a microscope. Like, for me, I gradually got into it. Started with 2.5 loops, 3.5, 4.5, and the thing about magnification is that the more you see, the more you want to see. And so, you kind of evolve into scopes, because there was an interesting thread on Dentaltown not too long ago where, some can't even, have a hard time even wearing loops because can cause some dizziness or nausea. And I've heard that before. And so certainly a microscope for them is not going to be a good investment. When I speak to other dentists, rather than trying to convince them, this is what you need to buy, whether it be microscopes or a laser or CEREC, this is what you need to do. I'm more interested in looking at their practice dynamics, because some things are just not going to work in some offices, and unless certain changes are made. So, a big pet peeve of mine is every time I hear of an instance where somebody went and they followed through the whole process of what I call the technology integration phase, right? Where they went through their discovery period, research the technology, ask people then they narrow it down to, okay, which manufacturer should I go with? And then they go all the way to the purchasing part. And then, either lack of training or whatever, what have you, or maybe they didn't think the whole situation through completely, like how this was all going to flow in their current practice, that the technology then gets thrown to the side, and you have a 25, 50, whatever, $100,000 piece of equipment that's now just sitting in the corner, just collecting dust. And so, with my consulting thing that I do, I'm not interested so much in convincing someone that they need a technology, I'm more interested to see if they're going to be able to integrate the technology, because there's no such thing as a good technology or bad technology. The only bad technology is a technology that's not being used. Okay, so again, I'm more interested in knowing, is this going to work for them or not? Because I would rather prevent them from getting into a situation like that, or let them know what is going to need to happen in order for a particular technology to be integrated fully. You're going to have to do A, B, C, D. Are you willing to make that commitment? Yes, great, go for it. No, save your money, buy a car, do something else.
I want to tell those young kids a couple things. When you fall down and break your arm or your leg, you always know what caused an acute accident. You always know, oh yeah, I tripped and fell and broke my wrist, or I fell down the stairs and broke my ankle. What you don't pick up on is the small repetitive moment injuries. When people go into the chiropractor or the orthopede and they have no idea why they're having this massive pain in their arm or their leg or their knee, it's some small repetitive deal that they never saw. And I'm telling you that, God, when you're 53, all those years you spent without loops and leaning your head over and torquing your back, and now there's so many 50-year-old doctors that there's either two camps. They're on a bunch of pain pills and muscle relaxers and go to a chiropractor 3 times a day, or they're like me who do yoga every morning for an hour and a half because you got in so much pain that by 50 you had to do hot Bikram yoga for 90 minutes, and that reversed you out of all those years of bad posture and leaning your head over. Your head's a 10-pound bowling ball, and it doesn't need to be upside down half your life looking into a tooth. You need to get loops, and you need to sit up straight, and you need to get them focused so that they're not even at the right focus until you're sitting up straight. And I know a lot of older dentists that got into microscopes just because of their neck and their back and their shoulders, and the only way they can do root canals for 8 hours a day is sitting up straight looking into a microscope. So are you using a microscope now?
Every day.
But what procedure? Is it just certain procedures or anything?
Everything.
And what is it? One microscope?
6.
6 different types and brands?
No. Same brands.
What brands are they?
I went with the globals.
Global. That's a very common. Is that the most common?
No. I think Zeiss is common too.
Zeiss out of Germany is very common. Where's Global out of?
Global's out of St. Louis, Missouri.
St. Louis.
Yep.
And so you've been a big global. So if you talk about loops, 2.5, 3.5, then you went to 4.8, 4.5?
4.5.
4.5. Is that all the same types? There's 2 major brands, Designs for Vision, and what's the other one? That's the one, Designs for Vision.
That's the through the lens type.
Through the lens.
Through the lens, Design for Visions.
Yeah. Okay, that's what I have too. And I'm at you said 2.5, 3.5, 4.5, I think, or is it 3.8?
No, it was mine were 3.5.
And then 4.5?
And then 4.5. When I got into them, that's what
I don't think know mine has an 8. I thought mine were 3.8, but I probably
they may have changed it now. But I'm talking early 2000s.
So this global microscope, is this on wheels, or with 6 of them you have one mounted to the ceiling above 6 hops?
They're all mounted to the ceilings in every op.
They're all mounted to the ceilings.
They're all mounted to the ceilings, and I have them in every op, including the hygiene ops. Because
and how much does something like that cost?
It depends what kind of accessories you get put on them. If you get like something called a beam splitter, which allows you to attach a camera or a video device to it, then it can raise the cost to over $20,000. But if you don't,
and you have the video on there for filming.
All my microscopes have a double beam splitter, where I have a video feed on one side and I have a DSLR camera on the other side. The video feed side goes into a live monitor so that my assistant can watch what I'm doing, which, by the way, for them, it's like, they totally get sucked into the procedure, when they're able to see exactly what I'm seeing on the TV monitor. It's also then fed into the computer system, so that while I'm treating, on every single tooth that I treat, or teeth that I treat, I'll take a pre-op shot, intra-op shot, and a final shot that all gets recorded directly into the Dentrix patient chart.
And this for a filling, crown, root canal, doesn't matter?
Doesn't matter. Doesn't matter because when I, especially with newer patients that don't know me for a long time, if they come in and, I'm telling them they have this problem, and, you can see they're not sure if I'm really telling them the truth or not, and I get into that tooth, and I've got that, number 4 or 6 round in there with cheese coming out of that tooth. I snap a shot of that and just put it right up on the screen for them when they come up. And
Dino, buddy, you gotta make an online CE course on this. No one's talking about it. Can you do that?
Sure.
I know. I've never heard of any general dentist with 6 global microscopes mounted on the ceiling, beam splitting, all this stuff. You got to. There's people listening to this, and I bet at least 10% of them are like, "Dude, I need more. I want all the details on this." That's something that has to be visual.
Okay. All right.
Could you do that?
I'll work on it.
Yeah, I call stuff like that dental porn. I mean, that just that would just be fun to watch.
But the really neat thing about this is not only does the patient see on the screen what I actually saw, right? I will print them out a copy of what I did for them to take home. Okay. And so that ends up being like an internal marketing tool, because now they go home and they show their significant other or their family. It's like, wow, he went into this tooth. Look what was in there. And so, a lot of times I'll end up getting the spouse or another family member. So it works as a great internal marketing tool, in addition to an educational tool for the patient. And it creates an unbelievable amount of trust very, very quickly when you can show instantly the patient. Dentists that are probably listening to this right now are probably thinking, yeah, well, I can do this with my intraoral camera too, which is true, right? But
I'm sorry, but if the loops were 2.5, 3.5, 4.5, what would the X be for these global microscopes, and what would the intraoral camera be? Because you can get a picture with an intraoral camera. Is that 10x, 12x, and what is your microscope? Or is
the microscope, I can take the picture at whatever magnification of the 6 magnifications. It starts at 2x, 3x, 5x, 8x, 13x, up to 20x, right?
So I can go to 20x.
Right, I can go to 20x.
2 to 20.
I rarely use 20, but
what do you usually use?
My favorite actually is the third step, which is 5x. And then when I get towards the refinement of a preparation, I'll bump it up to like 8. So I'm always between 5 and 8. But, and actually some microscope users ask this question a lot, because they do have 3-step microscopes instead of 6-step, where they don't have that lower end of magnification, the 2x or 3x, right? And so that's equally as important, because when you're doing a preparation, you want to be able to not only zoom in on it to refine it, but also zoom out of it so that you can get a good downward profile look of the preparation to see how it's tapering, make sure there's no undercuts anywhere. So you really, anyone that's thinking about, purchasing a microscope, in my view, you either go for the 6 steps so that you have all the ranges from low to high, and not go with the the 3-step, which starts you out at a much higher level. That's my feeling on that.
But what is the general cost on that? You said with accessories is all over it.
Yeah, about 25 grand.
20 to 25 grand.
Yeah. You see, now here's another thing that I see. Like because I also do training, private one-on-one training with dentists that let's say recently purchased a microscope. And I prefer actually to go into their office and do it rather than them coming to my office, because I get a chance to, inspect their environment and make sure that everything's mounted properly and set up properly. Because if you can't just grab it and use it, you're not going to use it. If you have to go through hoops of rolling it in, doing this and that, it's just not going to get used. So, it's important that if somebody does acquire a microscope, that it gets mounted in an ergonomically friendly position where you're going to be able, when you need it, you're just going to be able to grab it and use it, okay? But they'll buy the microscope, and they won't spend the extra $1,000, whether it's a Global or Zeiss, for what's called a binocular extender. All right. Now, what the binocular extender does is it brings the eye cups closer to one's eyes. And so now, instead of having the scope and having to scoot over, right, those binocular extenders bring the oculars out further, and now the operator can sit in a more straight up position. And so, you get a microscope without the extender. I don't feel that that's money well spent.
Okay, Dino, let's be honest. What percent of the 120,000 general dentists in America do not have a microscope? What would you say?
What would I say? I don't know. I don't know the answer to that exactly, but I think Glenn Van Az mentioned something like 1 or 2%.
Yeah, and he's
Right.
the finest dentist from Canada.
He's a great guy.
Yeah, fine. Love Glenn Van Ness. So the bottom line is about 4,000 people are going to listen to this, and 99% of them don't have a microscope. So we need to back up a few steps.
Yep.
Why should somebody listening to this podcast buy a microscope?
For some of the reasons that I mentioned, you can work comfortably.
Ergonomics, save your body, your neck, your shoulders, your back.
I used to be like this all the time, okay? And I have a chiropractor right in my own office building. And I used to see him once to twice a day. Now, mind you, I didn't get a microscope because of my back issues, but I found that once I started using it, that I didn't have to see him anymore. And in fact, I haven't seen him since 2004, which is when I started using the microscope. So I discovered that by accident. I was like, holy cow, I didn't realize.
And think how much money you save by not having to be the dentist that has to retire at 60 because they physically can't do it anymore versus the dentists that are still doing it at 70. The oldest dentist that went to my seminar for a year was last year, 93 years old, who survived Auschwitz. And guess what he did on his 90th birthday?
What?
Bought a CBCT, and now he's like crazy into surgical guided implants. He thinks
so cool.
Surgical guided implants are the neatest thing. And this little guy was telling me about it. I mean, I thought he was just going to break out in a cheer, like, give me an eye, give me an M, give me. I mean, and his assistants, his young little darling assistants were all like 70.
Oh, man.
And he's 93, and it's like you can't. So that $25,000 microscope, if that saves your physical instrument, so you can still do surgically guided implants when you're 93 years old. I mean, that implant is hell of a, it's free.
Correct.
Okay, so ergonomics,
so ergonomics, and what I was getting at too before was that some dentists that were as far as the taking photography pictures part, right, and sharing with patients, you can do it with an intraoral camera also.
So we'll call that marketing.
So yes, so from an internal marketing standpoint, or from a patient education standpoint, if you just want to quickly show them what was seen inside when you were inside working, you have to think of the ergonomics of that, right? So you have the patient down, you have to stop what you're doing, you got to grab the intraoral camera, more times than not, you're running behind, you're not going to go through that trouble, right? Whereas I do it with every single patient because it's just so easy. I literally just tell my assistant while I'm working. I don't even a lot of times I don't even take my hands out of the patient's mouth. I just tell my assistant, snap this for me. Bam, snap.
I want to ask you this a reverse way. So the American Dental Association recognizes 9 specialties. 7 of them are clinical, 2 of them are non-clinical, oral radiology and public health dentistry. But of the 7 clinicals, which one of those are using microscopes? The most 7 clinical specialties using a microscope to the least, because that might help a general dentist think, her mix of procedures. What are the specialists doing with microscopes?
The most obviously number 1 would be endodontists. I think a very
explain why.
For locating canals, accessory canals, also.
Which they say the number 1 cause of a failed root canal is a missed canal.
Correct.
And all the dentists want to talk about is what do you obturate with? You know,
Did you see the thread the poll thread I just posted just last night?
for last night, no, I did not.
Okay, so
There's no
it
Wi-Fi in the bar I go to.
it basically showed a case where you know most dentists thought it was a goner, and I probably would have thought it was a goner myself 10 years ago. But you know
You started a
when
thread on this last night.
yeah
What's it
yeah
called?
it was just a poll on whether you think this tooth
Oh, it's
can
a
be
poll. You're
saved.
saying poll. P O
It's
L
a
L.
poll, but I posted some photos
Oh,
and
really? I
and and
love polls.
I posted some photos. I showed the beginning shots of all the decay that was present in a tooth, and something like I think so far 75% voted to extract it and pull it and put an implant. So I find that interesting.
So what did you do? Did you pull it or you retreated it?
Uh, no, I excavated it and I treated it.
What number of
And
tooth?
it's number 14. It's funny because I remember when I shot that case 7 years ago when I treated it. I had it all ready. I had it on my computer. I was like ready to share it on Dental Town because I just thought it was awesome. That I'm enabled to do things like that when I can see so well now, and then I started thinking about all the questions that were going to start coming. No, it won't last. It's going to, and so I said, you know what? I said, I'm going to skip that one, right? And so I waited and till I got enough time behind, and so I have 7 year post-ops of this tooth.
Oh my
And
God, you waited a long time. Of course, you've been in Townie since 2003.
and so it's not so much, a poster said, I don't know that we should be teaching, younger dentists, to do, to go after teeth like that look so hopeless. And my view is, I don't know that I'm really teaching anything to anybody. My main purpose is, I see so many posts where you can't, you shouldn't, you don't do this, that's going to do that, and I read this stuff and it's like, it's just not my world. And so, I post on Dental Town because I just like to share and not to really teach, but just to enlighten, to maybe rethink that, maybe that tooth that you're thinking is not savable, maybe it does have a shot instead of going right to the extraction, which you see a lot today.
Well, you know what? Not having a microscope, it's now costing me money because I bought the CBCT. I bought the
Awesome.
$100,000 CareStream CBCT, and now a lot of the cases I would have done endo, I'm now referring to an endodontist because I thought this is a no-brainer. And then you look at the CBCT and it's like one canal for 15 millimeters and it divides into two. And it's like, I can't see the
So
division.
you can actually see from the CBCT even
Yeah.
accessory canals or like lateral canals
Well, yeah. And the main canal, how it turns
is that right?
into two. And I'm looking at that thing thinking, well, okay, before CBCT, I just would have assumed it was one canal. I would have cleaned and shaped and one canal and turned it loose. And I'd have been fine. We'd all been good. But now I have a conscience and a little birdie on my shoulder saying, dude, that splits into two. And to me, so I just look at that and say, it's not worth it. So then I called my endodontist friend and I said, do you get mad that I send you all this, this crap? And they go, Howard, with a scope, I just make my preparation. I can see so then they got a microscope. They say it's just not a problem. That they love them. They do them, whatever. But a CBCT will actually increase your endo referral. It actually increases endo all across the board because you see those periapical radiolucencies when they're a millimeter. When
Mm-hmm.
on a PA you don't see them till 3. So I'm doing a lot more pulp vitality tests because you're looking at this tooth like, well, God, that tooth is perfect. Doesn't have a cavity, nothing's wrong with it, but it has a lesion on the end of it and it's small. And of course, you pulp test and it's dead. But I want to follow back on. I want to finish that.
Well, yeah. Can I just get back to one thing?
Absolutely.
So what I was saying before was that the microscope not only it enables me to better determine if something's really a goner or savable. But it also works the other way, where in the past, let's say I would have done an endo, post-crown, 3 months later, patient's coming, calling, pain, whatever, there's a lesion, tooth ends up being extracted, and there was a root fracture that I wasn't aware of. I can't tell you how many times, I'll go into a tooth, and while I'm opening the canals to do the endo, even though I'm doing less and less of them now, I refer more of them out than I ever did before, especially after seeing some of these cases on the endo files. But at any rate, when I'm in there, sometimes you can see the fracture going down, let's say the palatal root of an upper molar, and you instantly know that's a goner. Whereas before, I wouldn't have caught that. I would have went through and did all the work and not found out till after all the work was done that it was a goner.
Yeah, I don't even trust an endo retreat anymore because there's so many assumptions I don't get into. Number one assumption, they don't have a microscope. Number two assumption, you're sent to an endodontist who makes a living out of retreats and they don't have a microscope and they can't make money by doing the implant. I go out of my way to send my failed endos to an endodontist that has a microscope and can make money doing the implant. Because if your only tool is a hammer, everything looks like a nail. They always retreat it. They won't give it a 5-year money back warranty. They just say, well, I don't have any warranty. I just did the best I could. Yeah, you just want $1,500. But if you give a 5-year warranty where every year that it lasts is worth 20% of the value, and if it fails in 1 year, you get 80% of your money back. They won't do that. But the ones who have the microscope, they see this stuff. But if they can but the endodontist can extract the tooth and place an implant, now you got an endodontist who can make money doing it either way, and you got to be patient centric. And it scares me when a doctor can only make money doing a surgery because you look at some of the international data, like the United States has our women have 4 times the amount of cesareans than in other advanced countries. And then you look at the payment, well, they get $700 for a vaginal delivery and $4,000 for a C-section. And as a MBA, I'm thinking, well, that alone, just that might explain it. And of course, the OBGYN patients I have say, well, they're just doing them they're afraid of the lawyers. If they see any complication, they just go straight to C-section because they're afraid of lawyers. So, but dude, I am out of time. I can't believe we passed an hour. It's an hour and 1 minute.
Are you kidding me?
Yeah, our hours passed. Hey, you're so amazing. I love you so much. I respect
love
you so much.
Too, Howard.
Would you come back and do a part 2? I mean, I've done 75 of these things. I've only asked one other guest to come back and did a part 2, and that was Gordon Christian. But would you come back and do another one? Because I want to hear the microscope for the other 5 clinical professions, and I want to hear about LANAP because that is a very controversial thing. Seems like you believe it or you don't believe it. It's kind of like
exactly.
It's like the So would you come back and do a part 2 someday?
I would absolutely love to.
And we're going to pick up on microscope use besides endo, the other 5 clinical, and then I want to hear the whole LANAP story.
Okay.
And then you can talk about, and then you with CAD-CAM. But I want to end on one question that I feel safe enough to ask you, but I was too embarrassed to ask Kois. I was interviewing Kois, and he's just such a legend, and he's so that. But he's Greek, and I wanted to finish the question saying, hey, John Kois, you're Greek, big fat Greek wedding. Did you find that offensive or funny? So I didn't ask him that till I turned the podcast off, and I asked him that, and he just bust out laughing. And I just thought, damn it, I should ask him that on tape. So I'm going to ask you. You're Italian. This is a serious question.
Okay.
The Godfather series and the Sopranos. I mean, they're legendary. I mean, most guys, the Godfathers in their top 10. But a lot of times you read in the press, the Italians say, I find the Godfathers and the Sopranos extremely offensive to my Italian heritage. So I'm just going to ask you a cultural question. Godfathers, Sopranos, as an Italian, do you find that offensive, or is that just American history or world history?
Not at all. Not at all. That doesn't bother me.
But what are your thoughts on it?
Well, there's good and bad, no matter what the nationality, right?
Oh, absolutely. Except for the Irish. I'm 100% Irish. We are absolutely the most normal people on earth. And we don't even drink too much. Just ask us.
No, I actually love Italian jokes.
So so do you see it as just authentic world history? I mean,
Yes,
and do you think the
of course.
Godfathers and the Sopranos, is there any truth to that, or do you think it's just way too Hollywood drama and blown out of proportion, or do you think that's kind of, or did the Godfather kind of get the story right?
Mm, no, I think they probably got it right.
Yeah,
Yeah, because I I have family in Italy, not part of the mafia, but you know that have businesses where they've been confronted where you know they want payment or something will happen to your store,
yeah.
and so a friend of mine, a family member of mine there had a friend, and they actually blew their store up. So I don't think it's inflated at all what you see in the movies.
So I got four boys, and one of my sons loves the series. You know, you always want to do things with your boys. So I have watched more than my share of Godfather movies just because one of my boys has watched every Godfather 1, 2, and 3, I think like 10 times each.
Is that right?
But hey, you're coming back for part 2, you promise?
I promise. I
Okay.
promise.
Thank you so much for an hour, buddy.
Thank you so much, Howard. Take care.
All right, bye-bye.
All right, bye.